Let's talk about the OSCE today. OSCE is Objective Structured Clinical Examination, a practical-based clinical skills examination for nurses. We have got an amazing OSCE Learning. Our online learning platform is well known by many, accessed by many from worldwide. Before we talk about our OSCE online learning, let's talk about what is OSCE all about. OSCE is made up of 6 stations, 2 skill stations and 4 API stations. API stations are assessment, planning, implementation and evaluation. Each OSCE stations can last from 8 minutes to 15 minutes. Let's talk about the OSCE in little more detail. You get 2 skills and 4 API stations, total 6 stations on the test day. The skills may be any from just a basic life support, or giving an IM injection, or performing a wound dressing. You get from 8 minutes to 15 minutes. 15 minutes is for the ANTT, where you can get 8 minutes for BLS, which is in-hospital resuscitation. Here you'll have to practically perform doing a skill in a simulated safe environment, where examiner will be assessing you based on the marking criteria how you performed on the day. OSCE simulated examination, API stations, assessment, planning, implementation, evaluation stations are mainly based on patient journey. Patient journey means, let's talk about, for example, you are a nurse in accident and emergency, receiving a patient with a chest pain. The same patient you will be doing an assessment, and then same patient you will be doing planning, then administering medication, which is implementation, and then you are doing evaluation. Maybe you're transferring the patient to a different department. That's what's all about API. OSCE test may be a difficult task for many of you, mainly because you might not have experienced OSCE learning or simulation learning in your curriculum. You might not have been there in your nursing learning. It may be a very difficult task for many of you. Performing skill or an assessment may be a challenging task. For that, it's very important for practice. Practice will make perfect. So to practice, you need to have a platform to learn or refer to. Health skills training, we have put together fantastic online learning for you, where you can access from anywhere. You can rewind, forward. Our skills and online learning is prepared based on Royal Master in Clinical Nursing Procedure and OSCE marking criteria. See here some of our OSCE nurses, what they say about our online learning.